Now we want to bring you today's original with in-depth reporting on a topic we've been keeping an eye on. When you go to a doctor, like an emergency care facility, you expect that all available precautions are automatically taken for your safety, right? But what if the doctor who's examining you has COVID symptoms and comes to work anyway without getting tested? Well, according to a lawsuit filed in Houston against American Physician Partners, that's a private equity-backed emergency medicine staffing and services provider, that's exactly what happened. The lawsuit alleges doctors were encouraged to not test for COVID-19 and to come to work when they were sick or had symptoms under American Physician Partners management. NBC's Isa Gutiérrez has more on this story.
This January, Dr. Sonali Patel says she told her boss at the staffing company she works for she tested positive for COVID-19. In a recent lawsuit, she says he told her to come to work.
I was asked several times and pressured.
Dr. Patel is an emergency department physician at Houston Methodist Hospital.
I decided to take the 5 days.
In doing so, Dr. Patel says she went against the unofficial COVID policy of the for-profit hospital staffing company she works for, American Physician Partners. It provides medical staff to Houston Methodist and other hospitals. She and 7 of her physician colleagues now suing APP, alleging its officials pressed them to work while sick, even if they contracted COVID. NBC News has not independently verified the allegations.
I was ridiculed by the medical director in front of my other colleagues, saying, they're having to cover for me because I was staying home with a sore throat.
It's an approach they say one APP official described as the 4 M's.
Motrin, must not test, mask up, and man up.
A spokesperson for American Physician Partners told NBC News its company policy not to discuss pending litigation and declined to answer our questions about whether its staffing and work policies aimed to boost profits and appeal to investors. According to its website, APP provides emergency department staffing at over 150 facilities in 18 states. The company, founded in 2015, is backed by BBH Capital Partners, the private equity unit of New York investment firm Brown Brothers Harriman. A BBH Capital Partners official declined to comment, citing the litigation.
These companies have a lot of power, and they'll use that because the pressures for profit are so extreme.
More and more private equity firms are getting into healthcare, now owning for-profit staffing companies that oversee an estimated 40% of U.S. hospital emergency departments, according to financial records and academic research.
And they buy out a company with a lot of debt, and all of that debt then gets placed onto the company into an almost impossible situation where they have to expand and generate such high margin profits.
In a statement, a spokesperson for the Houston Methodist Hospital system, which is not part of the lawsuit, said in part the litigation was an internal dispute that had nothing to do with the care provided by the hospital, and that they were unaware of any ER doctor coming to work after testing positive for COVID. The lawsuit against APP, a sign of growing discontent among frontline healthcare workers about for-profit staffing.
You feel like you're just another physician that's filling a spot.
I think situations like this, overworking us, cutting pay, not being valued, not being appreciated, just lead many people to get closer to burnout.
Wow. Isa, so some state legislators in some states are actually proposing bills that would rein in healthcare acquisitions by for-profit and private equity entities. So what does that legislation look like, and what could it mean for staffing companies like American Physician Partners?
Yeah, Tom. So just a couple of weeks ago, state legislators in Pennsylvania proposed a package of new bills to, quote, safeguard the integrity of local healthcare systems and protect patients from suffering the repercussions of greedy and irresponsible hospital schemes carried out by private equity firms, end quote. So one of those bills, Tom, would establish a 2-year moratorium on the transfer of ownership of any health system or hospital in the state of Pennsylvania when it involves a for-profit entity. Another one of the bills that is part of that package is one that would altogether prohibit the ownership of any hospital in Pennsylvania by for-profit entities. So, of course, only time will tell whether these bills will get enough support to become law. But the point here is that states are paying attention and they're trying to do something about this, Tom.
Thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.